now.
This is group 7, and we are presenting the antivirals. This group is presented by
Gutana Day,
April Hawkins,
Isabel Iraheta,
Amanda Jedlicka.
and Jeannie Mcelroy.
What are antivirals used for? They are a class of drugs that are used for treatment of viral infections. These antiviral drugs are medications used to treat viral infections such as HPV, human papillomavirus, HIV, human immunodeficiency virus, and HBV, hepatitis B virus. Several classes of antiviral drugs include the following: agents for anti-hepatitis B drugs, such as adefovir, entecavir, and tetrabenazine. These drugs are used for the treatment of herpes and varicella virus infections. These infections involve genital herpes, chickenpox, shingles, Epstein-Barr virus infections, and cytomegalovirus infections. We also have the agents for anti-influenza drugs, such as oseltamivir, amantadine, and peramivir. These antiviral drugs are used to treat influenza virus. They have been developed to stimulate immunity against influenza A and RSV. These antiviral drugs for influenza prevent viral replication of respiratory viruses and are used to treat the respiratory viruses. Antiviral drugs' main function is to merely inhibit viral reproduction. They do not inactivate or kill viruses. By inhibiting viral reproduction, they are interfering with a particular time setting of the virus life cycle. To understand the antiviral agents, it is necessary that we review the life cycle of viruses and imagine sites for drugs to interfere or block. So starting with step number 1, attachment and penetration of the virus to the host cell. Step number 2, uncoding of the viral genome within the host cell. Step 3, biosynthesis of viral components within the host cell. Step 4, we have the assembly of the viral particles. And step 5, the release of the virus to spread and invade others.
Acyclovir, also called Zovirax or Sitavig, is a therapeutic antiviral. The pharmacological category is purine analog. Purines are building blocks of DNA and RNA, adenine and guanine. So the pharmacokinetics, how does this drug work? Acyclovir interferes with the DNA synthesis of the herpes virus, so at the biosynthesis level. The therapeutic effects include inhibition of viral replication and decreased viral shedding, as well as reduced time for healing of lesions in genital herpes, localized cutaneous herpes, which is shingles, chickenpox, also known as varicella, and cold sores. Absorption is relatively low at 15 to 30%. However, it is widely distributed. It crosses placenta and enters breast milk. More than 90% is eliminated unchanged by kidneys. The remainder is metabolized by liver. Adults, when they take this medication, the half-life is 2 to 3.5 hours. It is relatively low in protein binding at less than 30%.
So common adverse effects on antivirals. So the use of antiviral agents is frequently associated with various adverse effects that may be related to possible effects on dopamine levels in the brain. These include lightheadedness, dizziness, insomnia, nausea, orthostatic hypotension, and urinary retention. So Tamiflu is an antiviral that is available to treat influenza A and B viruses. It can also be used prophylactically to prevent patients from acquiring the influenza virus, although it is not a substitute for getting the influenza vaccine. Tamiflu, common side effects is nausea, vomiting, but it's less severe when you take it with food. Other adverse effects have been found: abdominal pain, nosebleeds, headaches, fatigue. More serious side effects have been found in children and teenagers, so seizures, confusion, abnormal behavior during their illness, and this can result in accidental harm to the patient. There are rare cases of allergic reactions that have happened where the patient experienced an acute rash, which needs to be treated by a medical professional right away, because it could be something like Stevens-Johnson syndrome, which is life-threatening.
Some nursing considerations when caring for clients who are taking antiviral agents in general is to perform a physical assessment on your patient, and that will just establish a baseline for you to know how the antiviral agents are working. Also to check the patient's temperature, and that way you can monitor for infection. Also providing patient education on taking their antiviral medications as prescribed and on a regular schedule so that the antiviral medication can work. And also having your patient avoid any hazardous tasks because these medications can cause dizziness and drowsiness at times. And then getting just into antiviral agents for patients taking it for influenza A or respiratory viruses. Some considerations are you're going to want to have your patient taking this medication at least 2 days after symptoms occur. And if you are administering the vaccination for influenza A, to do it before flu season starts. Also monitor the response of the drug. Again, this goes back to taking those baseline physical assessments and monitoring for adverse effects, including changes in your client's blood pressure, urinary output, or skin changes. For the antiviral agents for herpesvirus, and one of these medications includes acyclovir, like April has talked about before. Nursing considerations for this antiviral medication is to examine the skin, color, temperature, and lesions, and to monitor those adverse effects of the drug, such as rashes. For patients with herpes virus, you're going to want to ensure proper hydration when they are taking this medication to decrease the toxicity on the kidneys. And when you or the patient are applying the ointment, if it's a topically medication, to make sure that you and the patient are wearing gloves when applying that medication onto the lesions. For patients with HIV and AIDS taking antiviral medication, a nursing consideration is to monitor the patient's nutritional status and make sure that they are maintaining proper nutrition, to stop the drug if a rash occurs, and to administer this drug around the clock if needed in order to provide the critical concentration needed for the full effect of this drug. For antiviral agents for anti-hepatitis B and C, a very important nursing consideration is to withdraw the drug and monitor the patient if they develop any signs of lactic acidosis. Lactic acidosis is when the body's not getting enough oxygen in the muscles to break down glucose. Signs of this happening in your patient include a smelly, fruity breath, confusion, jaundice, trouble breathing, and exhaustion. And also advise your patient if they are breastfeeding or plan on breastfeeding that they will need to find another source of feeding their child while taking this medication. Also, the last consideration for hepatitis B and C is that this antiviral medication does not cure the disease, and there is still a possibility of transferring the disease.
For our prototype drug, we chose acyclovir. Some drug-to-drug interactions include probenecide, theophylline, and concurrent use of other nephrotoxic drug risks can cause adverse renal effects. Some client education is to instruct the patient to take medications as directed for the full course of therapy. Take missed doses as soon as possible, but not just before the next dose is due, and do not double dose. Advise patients that additional use of over-the-counter creams, lotions, and ointments may delay healing and may cause spreading of lesions. Inform the patient that acyclovir is not a cure. The virus lies dormant in the ganglia, and acyclovir will not prevent the spread of infection to others. Advise patients that condoms should be used during sexual contact and that no sexual contact should be made while lesions are present. Some evaluations of medication effectiveness include crusting over and healing of skin lesions, decrease in frequency and severity of reoccurrences, acceleration of complete healing and cessation of pain in herpes zosters, and decrease in intensity of the chickenpox. Some medication administration include for adults 5 milligrams kg every 8 hours IV, 7 days, or 200 to 400 milligrams every 4 hours by mouth for 7 to 10 days. And this is our reference and works cited page.
One.
For the rest of our presentation, we had decided to make a Kahoot. So here we go. First question. What are 2 side effects that contribute to acyclovir? Select all that apply. Good. Question 2. Acyclovir has a half-life of 4 hours. If Karen took 400 milligrams at 0400, how much would be left at 0800?
Acyclovir is an antiviral that treats herpes. Which routes of administration are available?
Good job, guys. Oh, I'm on fire. Oh, I'm coming for Belle.
Almost.
Okay, so a nurse is monitoring a client who is receiving intravenous acyclovir. Which of the following actions should the nurse take?
Oh, it's a split. Oh, yeah. There I go.
I'm coming.
Go, April.
All right. True or false? The use of any antiviral agent is frequently associated with effects on dopamine levels in the brain. Oh, I'm holding the crown. What antiviral is available to treat influenza A and B viruses? Who's TD? Now you're on fire.
That's me.
Which of the following is not considered a nursing consideration for patients receiving antiviral agents for HIV?
Oops, sorry.
It's okay.
But we all got it right, so it's totally fine because we all knew that.
A patient with hepatitis B asked how effective antivirals are and if she can still infect others. What is the proper response?
Bells on fire.
Fire.
There's a ghost that's beating Amanda. What is happening?
Agents for anti-hepatitis B drugs are the following except
Good job, guys. Oh man, no one can catch up to me.
the last phase of the virus life cycle is which of the following?
Oh, look at that.
I'm the only one who got it wrong.
Now for the winners.
I love that it dances.
Oh, yay.
Oh, who's it gonna be? Woo.
Yay, go April.
All right. Thank you everyone for joining in on this Kahoot.
I'm in fifth.